Welcome to RadPulse. Feel the pulse of radiology. This channel is dedicated to radiology professionals. I am Dr.D.Rajitha, Radiology Resident, Government Medical College, Anantapur. Today my topic of presentation is Decoding the Developing Brain, a clinical and radiological review of pediatric neuroradiology cases. I plan to present a series of pediatric neuroradiology cases. Today I will begin with the first case. Here, a 1-year-old male child by name Venkateshlu, who is referred from the pediatric department for the non-contrast MRI brain scan with chief complaints of seizures, global developmental delay with ataxia. The scan was done in the Department of Radiodiagnosis, Government Medical College, Anantapur with 1.5 Tesla MRI equipment. An axial T1 weighted image. There is abnormal configuration of the midbrain with thick, elongated and horizontally oriented superior cerebellar peduncles with deep interpeduncular fossa, giving the configuration of molar tooth. On sagittal T1 weighted MR image, there is enlarged fourth ventricle which is freely communicating with the retrocerebellar subarachnoid space. There is vermis hypoplasia. On axial T2 weighted image, we can clearly see there is abnormal configuration of the midbrain with molar tooth configuration, and there is enlarged fourth ventricle and hypoplasia of the cerebellar vermis. On axial flare image, we can clearly see the batwing configuration of the fourth ventricle. On clinical presentation of seizures, global developmental delay and ataxia, and imaging features of molar tooth configuration of the midbrain, hypoplastic cerebellar vermis and batwing configuration of the fourth ventricle, we diagnosed this case as Joubert syndrome. I will briefly discuss about the Joubert syndrome and its related disorders. Joubert syndrome and its related disorders are genetically heterogeneous disorders with more than 10 affected genes are identified. Joubert syndrome and its related disorders are also known as ciliopathies. They are primarily autosomal recessive disorders. The mechanism of Joubert syndrome and its related disorders is mutations of the ciliary and centrosomal proteins which affects the cell migration and axonal growth, which leads to failure of decussation of the fibers of the superior cerebellar peduncles and corticospinal tracts, which leads to a dysmorphic and clefted vermis. Coming to clinical presentation of Joubert syndrome in infancy, there will be neurological features, ocular features and respiratory abnormalities. Neurological features include developmental delay, ataxia, hypotonia and seizures. Ocular abnormalities like nystagmus, abnormal respiratory pattern like alternating hyperapnea and apnea. The incidence of Joubert syndrome is very rare, that is 1 in 80,000 to 1 in 1 lakh live births. There is no sex predilection. The molar tooth sign is the radiological hallmark of Joubert syndrome and its related disorders. This is the infographic image showing all the main features of Joubert syndrome and its related disorders. Here we can see the incidence is very rare, which is 1 in 80,000 to 1 lakh live births. They are also known as ciliopathies. The clinical presentation include developmental delay, ocular abnormalities like nystagmus and respiratory abnormalities like hyperapnea and apnea. The subtypes of Joubert syndrome and its related disorders are pure Joubert syndrome, coarse and Koch. In pure Joubert syndrome, there will be classical neurological signs will be there. In cores, including to the classical neurological signs, there will be ocular renal defects. In coach, there will be ocular coloboma, ataxia and hepatic fibrosis. On MR imaging, molar tooth sign is the obligatory imaging hallmark of Joubert syndrome. Along with the molar tooth sign, there will be deep interpeduncular fossa, thick and elongated superior cerebellar peduncles and clefted vermis. This is all about Joubert syndrome and its related disorders. To see more such videos, please support my channel. Please like, share and subscribe my channel. Thank you.